Hi, everyone, and welcome to our Quick Talk series, Quick Answers to Trending Topics. Today's very important topic is on why vitamin K matters at birth. I am Allison Circo, Regional Director of Community Outreach and Engagement with Hackensack Meridian Health, and I'll be your moderator. We're very grateful to have Dr. Inkisar, a pediatric hospitalist from Hackensack Meridian's Children's Health at Jersey Shore University Medical Center, speaking with us today. The information presented and discussed today is educational in nature and is not intended to be taken as a specific recommendation. If you have any personal questions or concerns, you should speak with your primary care physician. So we will get started now. So the first question we have, why does vitamin K matter at birth?
So I'll start with a scenario, that feeling like right after childbirth, when exhausted parents, their adrenaline is completely dumped out of the system. They're exhausted, holding a tiny, slippery human being, right? And in that haze, when you're trying to figure everything out, a nurse or a hospitalist walks in with a syringe, right? It's a really jarring moment. Like, obviously, they're trying to protect the baby for 9 months, and all that medical system wants to do is poke them, right? So in that moment, I just want to say that it's not just a poke. It's like the first insurance policy you're buying for your child's brain. And I totally understand their primary, protective instinct. Like, can we just wait for a minute? Is it necessary? Or can we do it later? So this is all our talk is about. We'll talk about neonatal vitamin K. And first thing is, we'll talk about, we're not talking like doctors recommend this. We'll talk about the mechanics and biology, why newborns are deficient in vitamin K. So the newborns are born with tank almost completely empty. It's like minimal or very undetectable levels of vitamin K. So it comes down to perfect storm of 4 biological hurdles. You can see that. This is the universal constant in neonatology world. Like, every newborn arrives with a vitamin K deficit. The first hurdle is this poor placental transfer. Like, very minimal amount of vitamin K crosses from the mother to fetus during pregnancy. And now, once the baby is born with vitamin K deficiency, the second hurdle is the sterile gut theory. So you and me, like, our gut is massively colonized with the bacteria, and which is actively synthesizing vitamin K. But our baby's gut is clean. It's not colonized by bacteria, so they're not making vitamin K. And then it comes down to their liver. Their liver is very immature, and they have very limited stores of vitamin K, and they're not able to store because their liver is not holding on to vitamin K. And the fourth hurdle is their diet. Like, mostly babies are breastfed, and the breast milk is a miracle fluid for growth, bonding, immunity, but it is very low in vitamin K, like very shockingly low in vitamin K levels. So these are the hurdles. The baby is born without vitamin K, and then their gut can't make it, and then they're not getting enough from their diet, and they can't store it well, right? So this all makes them vitamin K deficient. So now we'll talk about what is vitamin K. It's a nutrient, it's a fat-soluble vitamin, and the basic function of vitamin K, why we worry about vitamin K deficiency bleeding. Like, whenever we get a cut, we have these proteins, like inactive factors in our blood, 2, 7, 9, 10, and protein CNS. So you can think about this analogy like our liver has this engine, it has these factors, but it needs vitamin K as a spark plug. Like, it needs vitamin K as a spark plug, or it's like a key in the ignition. So they have the machinery, but they don't have any vitamin K to turn it on. So that's why they can bleed and there's nothing to control their bleeding. So now we'll talk about the consequences of vitamin K deficiency, which is the vitamin K deficiency bleeding. It's a catastrophic thing. It's a horror movie state. So we should focus on, like, first I'll talk about how we break down vitamin K deficiency bleeding into like 3 types based on the timing. And like what makes it more scary is the timing. So you can see there are 3 types. The first type is early vitamin K deficiency bleeding. It's within the first 24 hours of birth. It's often like mostly associated with the drugs, medications mothers taking. Like most common is anticonvulsants or warfarin, rifampin. The second one is classic vitamin K deficiency bleeding. It presents from 2 days to 7 days within a week. Like the baby can bleed through their intestines. It can, like, they can bleed through their umbilical cord, or if they're circumcised, they can have excess bleeding. And it's not controllable. The third, late vitamin K deficiency bleeding, which we should focus on, which drives us this whole recommendation of vitamin K IM shot. This is the monster in the closet, actually. It can present from 2 weeks up to 6 months. And risk profile is almost always the same. It's primarily in exclusively breastfed infants who did not receive the vitamin K like prophylaxis at birth. So, and then the thing is with late vitamin K deficiency bleeding is the first sign of the problem itself is catastrophic. That their babies, they look healthy, they're nursing well, they're feeding fine. It's just like their clotting cascade is not working, right? So when they present with mostly intracranial hemorrhage, that is bleeding in the brain. And almost like 50% of them present with this bleeding in the brain. And the mortality rate is very high, it's like 20%. And the rest 80% who survive, 40 to 50%, they can suffer from permanent neurological long-term damage. And the risk is low frequency, but the impact is high. You can see that. So these are the 3 windows of vulnerability, but from 2 weeks to 6 months, it's a danger zone. So you can see, I already discussed about the timing and the high risk of intracranial hemorrhage and high mortality rate. And the onset is delayed. So people think it's mild or babies like asymptomatic. But the thing is, when it presents, it can present with this bleeding in the brain. So now the first question is, why is the IM vitamin K injection so important? Like parents usually ask us, why not oral, why not pill, drops, or why IM? So this really comes down to the main thing, like how it processes like in our body. So when the vitamin K is injected to the thigh muscle, it stores in the muscle memory. So muscle like releases the vitamin K slowly, gradually over weeks and months. So it usually produces sustainably, like, controlled vitamin K over the 6 months. So it covers the entire vulnerable window that we talked about, right? The danger zone. It's basically bridging the 6-month vulnerable window. So that's why we recommend IM vitamin K injection. You can see the dose for preemies, it's less than 1 milligram, it's 0.5 milligram, and more than 1500 grams infants, they get 1 milligram. And this is gold standard. It can reduce the late vitamin K deficiency bleeding by 95%. And why not oral? Or because, the infants who do not receive vitamin K IM prophylaxis, they're 81 times more likely to develop this bleeding compared to those who receive vitamin K at birth. And safety data, like it's safe, it's very safe, it's been used over 60 years, and there's zero link to any side effects. We'll talk about the side effects later. So the first thing is, Why not oral vitamin K? It goes back to the infant's gut. Let's suppose if baby's spitting up, is having diarrhea, or like having an off day with absorption, the dose passes right through. It's not effective. And the compliance is the issue with oral vitamin K because it requires weekly dosing over months. So you're asking exhausting parents to stick to a schedule. It's like hard, right? If they miss the dose, the efficiency goes down. So that's why we recommend IM vitamin K, and the oral one is not FDA approved also. It's not regulated by FDA. And let's talk about most common parent concerns. First thing I talked about already, like it's safe. Yes, it is. There was a study back in 1990s saying, like in England, very small study, that there's some minor linked to childhood cancer, but mind that it's massive. It's debunked by massively large studies with millions of children, and it's shown there's zero link to any childhood cancer. Second thing is, it's not a vaccine. It does not interact with immune system. It's a nutrient, like I talked to you about. It's a fat-soluble vitamin. It's not an immunization. It just activates the clotting factors to help control the bleeding. It's just like spark plug to activate the machinery that we have. And can we wait? I already talked about like the delay or refusal can significantly increase the risk of life-threatening bleeding. I just use this analogy, like if you sit in the car, you put the seatbelt on, right? And you don't do this like, okay, I'll sit in the car, I'll drive around, get the feel of the road, and then I'll buckle up. You don't do that, right? Accident can happen anytime. It's just like that, vitamin K deficiency bleeding, especially the late one, it can be immediate, and you can't retroactively control that bleed if it's happening right now. So waiting a week or delaying it is catastrophic. So first thing is addressing specific parent questions. They're concerned about the pain. Obviously, it's awful. Many babies cry, but modern care involves parental involvement. So we recommend skin to skin contact. They can feed the baby while the shot is being given, and that helps with soothing the baby. And other thing we use are sweet teas or sucrose solution. It's like sugar that can help release endorphins, and it blunts the pain signals so they don't feel the pain. It's just like you hold them against your chest while the shot is given. You can feed the baby, and they cry for a few seconds and they settle down instantly. And it should be given within 6 hours for optimal protection. That is the recommended dose. So you can see that's another very important question that parents ask us. Does vitamin K1 injectable have preservatives? It depends on the brand. Our Jersey Shore hospital have preservative-free products are available. The only preservative they use is benzyl alcohol or phenol, and it's used in many vaccines and medications also, and it's not harmful. And you can see the vitamin K injection that's available, and it's intramuscular. That is the recommended one. So I already talked about like why oral K is not the route. Absorption, compliance burden is there. It's like many countries, they have approval for oral vitamin K, but they're high failure rates for late vitamin K deficiency bleeding, and it's not FDA approved. So I think some parents, they think they want to keep it natural, but I would say like this whole topic actually challenges the definition of natural, right? Natural doesn't always mean like optimal or safe. Like babies are born vitamin K deficient. That's the most natural thing in the world, right? But you have to protect them, right? And I think nature cares about survival of species. Medicine also cares about individuals' well-being, right? So I think clinical takeaway is we should know that all newborns, whether small or big, they're vitamin K deficient. And there's a famous quote by a hospitalist, I don't remember the name, but he said, like, there are many tragedies in the hospital, those are like random and unpreventable. But this one, vitamin K deficiency bleeding, is 100% preventable, but by just giving one IM single shot. And I think that is powerful, and it's a profound gift of modern science that IM vitamin K can protect the babies from the bleeding by more than 95%. So I think it's the simplest intervention in this, and we have that prevents the irreversible harm in newborns. And I think in this world of uncertainty, when you get a guarantee like that, it's like one single intervention can prevent your baby's brain from devastating injury.
Very important information. Thank you so much for sharing about the importance of vitamin K. Do you have any a quick story that you would share, like maybe a family that wasn't going to do it and then decided to do it, or anything a family shares with you regarding it?
So we're getting a lot of vitamin K refusals in the nursery, and we do convince them. But I had when I was working on inpatient side, I had a 7 weeks old who presented with this intracranial bleeding. And then we found out like mother delivered at a birthing center and the vitamin K shot was not given. And luckily, the baby survived. The baby had bleeding, bruising on the skin, but luckily the baby survived. But then the mother realized like her half of the kids got vitamin K, but later on for the other kids, she decided not to give them. And now 1 out of 3 had this bleeding, right? So then she realized like how important it is. And I think that's why I tell all parents, like, it's the first insurance policy you buy for your child's brain. And if you don't protect them, natural is safe, but sometimes it's just like the God started this all machinery. You just have to complete it, and you just have to finish finish what nature started. Like, there is everything there. You just have to give them so the machinery starts working, right? So,
perfect. And thank you. Your analogies were very helpful in helping to understand it. So hopefully by providing this education, we'll get it out there to educate on the such importance of vitamin K. So I want to thank you so much, Dr. Inkisar. This was very helpful and informative. And thank you to those who are taking the time to listen to this. Please visit our website at hmh4u.org/kids to find out more information and to listen to other education programs. We hope that you enjoy your day, and thanks again for listening in. Thanks, Doctor.
Thank you.